Hi there. My name is Sadia. I'm here to talk about what it's like living with the diagnosis of major depressive disorder. First, major depressive disorder is a neurological condition that causes low or depressed moods um, for days. Could be in perpetuity, especially if it's untreated. Loss of interest in activities that were once interesting, and just an overall low energy disposition day after day. Um, Me and other diagnosed people feel just like disinterested, helpless, cut off from reality, really. So I wanted to just kind of give out what my journey has been, how I even came to this point. In 2021, February 2021, my father passed away. And even before then, like even the lead up to his passing, I had been like noticing a steep decline in my once normal, I would say jovial, I think is the word, jovial, happy, naturally happy disposition, to once I started to see my dad's decline, then that really took a hit to my psychology. But it wasn't until, so he passed in February 2021, and then it wasn't until September 2023, a series of accidents that I will go into at a later date probably, happened, and I was checked into a mental health treatment facility. I was there for nearly a week, and that's when I got diagnosed with major depressive disorder and anxiety. And so ever since September 2023 to now, it's April 2026 right now as I'm recording this, I've been slowly coming up from depression, from just having like a helpless worldview and just a natural lack of energy. Like I remember sleeping for 10 to 12 hours a day, sometimes more, never smiling, never, like, I remember my face feeling stuck like this. And just not ever having some sort of fluctuation in my mood. Like I could go the whole day, 24 hours, just with stone face. But now, having been on this healing journey for almost 3 years now, I've noticed I've come back to my former personality, my former joy. And I kind of just want to share that, especially with other people with this diagnosis. Also, I've been seeing a psychiatrist too. So I've had a psychiatrist now, honestly, on and off, because just like being in, I guess, the typical US Medicaid system, having to deal with community hospitals, you're gonna be waiting a few months to get to a psychiatrist. And if you get one, they may or may not, it's a 50-50 chance that they may or may not be a good fit for you. But fortunately, I've been able to see a really good psychiatrist the past couple of months. I've been able to be consistent there. I've seen him like twice now since the year started, and it's been really cool. I asked him if there might be some sort of underlying autism that I'm also dealing with. I say that because I just I have like neurological disconnects that come up, especially like the couple of times that I've been able to hold down a job. Honestly, I'm like since my diagnosis, I've only had a handful, like 5 maybe, and they haven't lasted even a whole year. Some not even 2 months. And it's always some neurological disconnect where I'm just like, I gotta get fired, or I don't want to work here anymore. And yeah, I end up getting canned. So yeah, I asked him like, why is that? What something just inevitably happens where I do something that I'm not even thinking about, and then that lands me back in unemployment. So I told him maybe I have some type of autism too, and he gave me a test. Hold on. It's called the RADS test, and I just fill out this packet, and based on the answers I give, my psychiatrist will be able to know whether I have autism, Asperger's, what have you. And so we'll get that settled on the next one, part 2. But yeah, I want to talk to other people who have this diagnosis. What is life like with major depressive disorder? Do you see any improvement since you learned of this? Do you take any medication? I know one of the most popular ones for anxiety is one that I'm on. It's called sertraline, and I think the other name for it is Zoloft. Yeah, talk about your diagnosis in the comments. I promise to read all the comments and respond. And let me know if there's a community of folks like this, and let's get some discussions going.